Parkinson's disease is a chronic progressive disease of the central nervous system that affects movement. The cause is unknown and there is currently no cure, but treatment of the symptoms can help. One of the major symptoms of Parkinson's disease is postural instability or impaired balance and coordination. Because of this issue with balance for patients with Parkinson's, fall prevention strategies are very important. This program should include exercise that focuses on challenging and strengthening a person's balance, core, and flexibility, as well as making the home safer by making walkways wide and having even floor surfaces. In the following scenario, the patient is a 76-year-old male with Parkinson's disease. He lives at home with his wife, who is his primary caregiver. He has fallen in his home several times over the past year, usually when getting up for breakfast. His doctors recently increased his medicine, but we will be teaching him some fall prevention techniques. Our program for him will include 2 exercises to increase balance and strength, and looking at some changes in his home environment to make it more safe. At the end, we will finish with some general information about exercise to improve balance. I will play the role of Mr. S, and my partner will be acting as the physical therapist providing the fall prevention program.
Hi, Mr. S. I'm Taylor. I'm your student PPT today. And today we're going to be starting with sit-to-stand exercises. So first, I'll let you watch me do it, and then I'll ask you to show me it, okay? So when we begin, we're going to make sure we tuck our feet underneath us. And then we're going to use the sides of our chair to push up. And when you get up, I want you to place your hands on the table to help you gain your balance, okay? So I'll do it one more time. So tuck my feet and push up, and then grab the table, okay? So I want you to go ahead and try that. Okay, great job. And one key thing is, whenever you're here, we're going to have you do things on your iPad to keep you standing for a while, or your wife could come in and play checkers with you, or you guys could do something like that. Okay? Do you understand things?
Yes.
Okay, I'm going to have you do it one more time. Go ahead and reach back for your rails and sit down. Okay, and we're going to stand up. Great job. Okay, good job. All right, Mr. S, now we're going to move on to some dynamic yoga type exercises. So again, I'm going to show you first so you can get a visual idea of what we want you to do. So we're going to get down on all fours, and what I want you to do is lift opposite legs. So if I do my right hand, I want you to do your left leg and hold it, okay? And then we'll move on to our left hand and lift our right leg. Okay? So do you and your wife understand this? Okay. So I want you to get down on the floor. Do it carefully. Okay, and again, I want you to lift your right hand and then your left leg. Okay? Great job. Okay, go ahead and put it down. Okay, and do your left with your right hip. Great job. Okay, you can go down. Now do one more set just so we feel it again. Great job. Okay, one more. You're doing great. All right, Mr. S, now we're going to talk about some home safety things. So we're going to use the same principles we did in our sit-to-stand exercises, so when you stood up at the table. So when you wake up in the morning, when you've been having most of your falls, we want you to use a walker to gain your balance before you start moving throughout the house. So when you wake up, you would sit in bed like you are for a little while so you don't feel dizzy. And then I want you to use your same sit-to-stand exercise and grab your walker, okay? Okay, great. And I want you to stay there until you feel like you're really stable and ready to move.